It all started back in early June when he had pericarditis and was at Smith Northview. Dr. Cohen picked him up as a patient there because he had, some echoes, and it showed that he had pericarditis. Then afterwards, he was followed by his primary care, Dr. John Anderson, and Dr. Cohen. Dr. Cohen did a stress test, and the stress test showed that he had a 40% ejection fraction. And again, as he has said, we didn't know that he had anything wrong with him. He was so very active. When we got the results of the stress test, it showed that he really needed to have a cardiac cath. So 2 days later, he wanted to put it off, but 2 days later he had a cardiac cath here at the Dasher Heart Center. And when Dr. Cohen came out and told us initially what they found, one of his vessels was blocked 99%, and I was overwhelmed because I knew that meant surgery, and he said it was blocked so much that there was no way a stent would work. So then Dr. Johnson came in, Kelly that works with Dr. Johnson came in, several of my nurse friends, Pam Powell, Susanna, and they were just talking me through it. Nobody tried to convince me of anything. They were just talking me through it and telling me about the team and what the team, I think they'd been here about 3 weeks when we were here, and I just felt reassured.
Whenever I woke up from my heart cath, both our cardiologist and the surgeon was standing there and told me what my condition was and told me what they had available and wanted to know my thought about it. And the way both of them talked, I said, well, like I say, let's take care of this problem right now. And it's one of those things where Dr. Johnson was standing right there, and he said that he'd take care of me, and he really did. A fine surgeon. I'd recommend him highly. After my surgery, like I say, they got me up the next morning, and every morning thereafter, and we walked the halls. And we had a kind of a cheering team that cheered everybody along as while you were walking. All of the staff, it was shocking as far as not just the nurse on duty for me that day, but the whole team. They would come by and tell me what happened and check on me and how I was doing.